Okay, welcome everyone to the Hawaii Care Choices Healthcare Resource Talk Story. I am Tish Fukushima and I will be your moderator this morning. Presenting today will be Lani Weigert, Community Relations Manager. We also have two special guests that are joining us today. But before I start, we want to ask the audience, for those of you on Zoom, if you can hear me and see the PowerPoint that is on the screen, please give us a thumbs up. All right, wonderful. To all of those watching on Facebook, aloha. We want to let you know that today's Zoom meeting is being recorded so that you and others may access it in the future. To our Zoom participants, if you have any questions at any time, you may use the chat feature. You can also utilize the Q&A box at the bottom of your screen. For those of you on Facebook, please use the comment box to chat with us. I'll be monitoring them as your questions come in, and I will be asking your panelists. We also are doing polls today. For those of you watching on Facebook Live, you'll not be able to engage in the polls, but if you do want to join in the fully engaged Zoom presentation next month, please email me at lfukushima@hawaiicarechoices.org. Again, lfukushima@hawaiicarechoices.org. So the polling is very simple. There's no right or wrong answers, and here's how it'll work. A question will pop up on your screen. Please make the selection that you think is best and submit your poll. To kick things off and get you all comfortable, let's try an icebreaker. All right, the question is, if you could be any animal, which one would you be? The choices are a horse, a turtle, or a bird. Again, for those of you watching on Facebook Live, you'll not be able to engage in the polls, but if you want to join in the fully engaged Zoom presentation next month, please email me at lfukushima@hawaiicarechoices.org. All right, we have our results, and I'm going to share them with you. 46% of our attendees would want to be a horse, 8% would want to be a turtle, and 46% would want to be a bird. So great, you have just gotten through your first poll. Congratulations. All right. Excuse me. Now I would like to introduce you to our speakers today. Lani Weigert, who is the Community Relations Manager for Hawaii Care Choices. Aloha, Lani.
Aloha. Aloha, everyone. Thank you for joining us.
We have Gail Kaho'okele. She is the Executive Director at Hale Anuenue Restorative Care Center. Aloha, Gail.
Aloha, everybody. Good morning.
We also have Mitch Roth, Prosecuting Attorney for Hawaii County, Hospice Advocate, and 2020 Mayoral Candidate. Aloha, Mitch. Thank you for joining.
Everybody.
Thank you all for joining us today.
Thank you.
Again, I'd like to say aloha to everyone who joined and who just joined in on our webinar. I am Tish Fukushima, your moderator this morning. Today's Zoom meeting is being recorded so that you and others may access it in the future. For Zoom participants, please feel free to use the chat feature for any technical questions and the Q&A box to ask any one of our panelists a question. Those of you tuning in on Facebook Live, feel free to leave us a comment. I will be keeping an eye on those as well. Presenting today will be Lani Weigert, Community Relations Manager of Hawaii Care Choices, Gail Kaho'okele, Executive Director of Hale Anuenue Restorative Care Center, and Mitch Roth, Prosecuting Attorney for the Hawaii County, Hospice Advocate, and 2020 Mayoral Candidate. Without further ado, I will turn the virtual microphone over to Lani. Mahalo. Lani.
Aloha, aloha, everyone. Thank you so much for joining us. Thank you so much, Tish. So let's get right into it. We have a lot to cover today, and I wanted to share with you some of your healthcare choices that are available out there in the community. So first, I'd like to share the 3 different programs that we have here. And the first one is palliative care. The second one is hospice care, and the last one is bereavement care. For some of you who may not know, Hospice of Hilo changed our name to Hawaii Care Choices. And the reason we did that was because we do so much more than just hospice care, as you can see on your screen now. When we added palliative care, which is a pre-hospice program, many people were not aware of it. And for those who were in the program, they didn't want to be in Hospice of Hilo. Plus, we did have bereavement care, which is also offered out in the community every Tuesday as a free support group that we provide. And so basically, we couldn't limit ourselves by calling us Hospice of Hilo. Therefore, we went ahead and changed our name to Hawaii Care Choices. So Hawaii being the place in where we provide these services, care, which will always be the center of everything we do, and choices is exactly what we'd like to provide to you. So let me just get right ahead and start explaining to you about palliative care first. So what is palliative care? First of all, a lot of people have never even heard of the word palliative, but to palliate means to ease, to alleviate, to soothe, and to really make people feel so much more comfortable. And so in this palliative care, it's a specialty type of care. And in fact, it has a very large umbrella, which hospice care comes under as well. So what happens for palliative care that we provide right now to our East Hawaii community is for those dealing with a serious illness, such as cancer of any stage, COPD, congestive heart failure, and kidney failure as well. And so what happens is with these serious illnesses, people normally go for treatments. And when they have treatments, those treatments create very uncomfortable and painful sometimes symptoms. And so it is a special type of care that addresses that. It's not only physical discomfort and pain that we deal with. We also deal with the emotional pain of having a serious illness as well. And basically, palliative care was created to boost the quality of life for both patients and families as well. Now, who is appropriate for palliative care? So anyone, like I said, that was dealing with these serious illnesses that are stated here. And a lot of people had no idea that we could also service children. So patients of any age and at any stage of their illness, particularly in cancer. And others too who continue to receive treatments such as chemotherapy, radiation, dialysis, and maybe they have to go for surgery related to any of their illnesses. A lot of times discomfort and pain is associated with that. And so calling for palliative care would be most helpful. A lot of times people don't know that. And so as a result, they just deal with the chronic pain, which really does diminish their quality of life. And so we're so happy now that we can provide palliative care to all those who are dealing with serious illness such as this. And what's great to know is that people who are on palliative care do not have to wait for a 6-month life expectancy or be terminally ill. They can continue to receive treatments and we can continue to serve them in their homes.
All right, here is another poll. The question is, the goal of palliative care is to improve the quality of life for the patient and their families. True or false? Again, I just want to reiterate for those of you watching on Facebook Live, you'll not be able to engage in the polls. If you would want to join in the fully engaged Zoom presentation next month, please email lfukushima@hawaiicarechoices.org. All right. Looks like we have ended, and I'm going to share the results. 100% of you said the goal of palliative care is to improve the quality of life for patients and their families is true. Thank you all for participating in that.
I just love when people are paying attention like that. That's so wonderful. Everybody must have had your morning tea or coffee because everyone's alert. Yay, that is the correct answer. We don't only come in and impact the patient, but we also are boosting the quality of life for the caregiver and family as well. So that was absolutely the correct answer. So sometimes people will say, well, when do you think my loved one is ready for palliative care? And these are some physical signs that you can see at home. So one of the things is when your loved one or yourself tend to go to the hospital for frequent visits. And when I say frequent visits, I'm saying like 3 visits in a month. That's a lot of visits to go to the emergency room. Also, having difficulty managing your medications. What happens is you start to get confused as to, oh, do I take this one or that one, etc. It's really starting to become too much and overwhelming to really manage your care. Also, diminished activities of daily living. You know, a lot of people have no idea exactly what that is, but in everyday living, people try to manage their finances, you know, balance their checkbook. They drive, they go to the grocery store, they prepare a sandwich for themselves, and they do housework, whether it's light or heavy, but they, you know, maybe throw in a load of laundry or something. When you see that yourself or a loved one has difficulty in doing any of those things, it may be time for palliative care. Also, other physical signs on the body, such as swelling in the feet or legs, and then the feeling of nausea, and always tired, always want to go to sleep, and then having pain within the body more than every day is quite a big sign of palliative care might be needed. So when should palliative care begin? A lot of the doctors that come on our Talk Story, they recommend that people should contact us for palliative care as soon as they are diagnosed. And the reason is because a lot of times there are no symptoms yet. And so, which is why most people don't contact us, but because there's no symptoms yet, the patient and the family can really ease into the idea of palliative care at home. And so what ends up happening is that they can kind of sit at the side of the pool and put their legs in and just kind of watch what's going on and just really warm up to the idea of having this specialty care. Also, at any time throughout the course of the disease progression, palliative care can be provided as well. And then those with serious medical issues, when they sign up for palliative care, sometimes it does tend to not only boost their quality of life, but extend their life as well. And that's largely because both are related. When people are feeling better and not depressed because they're not always in pain, they do tend to enjoy life more. What to expect when you sign up for palliative care? So first of all, our nurse will come to your home to visit. And he or she will evaluate your health, your medical history, and we'll also talk story with the family too, so that they're more comfortable with even the idea of somebody coming into the home, but also to understand the program. What is really important about palliative care is that we have a holistic approach to palliative care. So it's not only your physical ailments. We're looking at your emotional stress as well. We're looking at maybe there could be other types of pain that you're dealing with. And the other types of pain I'm talking about is spiritual pain, the pain of isolation, even financial pain as well. We like to come in and find out what are the patient's goals. Some of the goals are very lofty, such as I'd like to go to Disney World with my grandchildren next year, so I want to be well enough to do that. Or it might be as small as I just want to be able to rise up from my living room sofa and walk to the mailbox, get the mail, come back and be still able to breathe without being completely and totally breathless. And so when we hear these goals, it's important to always have goals because we want our patients to be striving to meet these goals. And that is why we're there in the home to try to help them achieve it as well. Medication review is one of the main aspects of providing palliative care. And the reason is because currently in our healthcare system, there isn't a way for us to link all the places that one gets their medication. So, for example, a person could be getting their medication from their primary care physician, and then they might go to see their cardiologist or maybe whatever ologist that they see and get more medication. Maybe there's some kind of crisis in the evening and they have to go to the emergency room and then get more medication there. So what ends up happening, as you see on this picture with this couple that's just dealing with all of these medications, it is a balancing act, and you can understand why it gets overwhelming is because the doctors are not necessarily talking to each other at all about, oh, I gave this medication, I gave that medication. There are times when we will go into someone's home and there'll be more than 50 jars of medication on their coffee table. And the reason that happens is because they're getting medication from all of these places. So when we come into the home, we take a complete inventory of all of the medications that are there. And then we call the primary care physician, who is always the lead on our palliative care team. So in other words, when a patient comes to us, their doctor still remains part of the team and in fact is guiding us. So we'll share that with the doctor, and normally the doctor will let us know, well, I see that the patient now is taking 36 different medications. Well, I want you to cut all of these other medications out, and maybe at the end there's 14 medications being taken, which is still a lot, but so much better than 36 medications. And so we find that once the medication review is done, oftentimes maybe 5% of symptoms that our patients are dealing with, they immediately go away. So you can see how it's so important to have that aspect in a palliative care program. Now, how does palliative care work? Okay, so we come in and we help the patient manage their pain and symptoms. So what ends up happening is, say we come in and the patient has cancer and they're so tired, sometimes they're nauseated, or maybe most times they're nauseated, and then they have pain that doesn't seem to go away even when they take their medication. We will then start working with both the oncologist as well as their primary care physician to find the proper medication at the proper amount to really help the patient gain comfort. And so that's part of our care coordination when we come in, because a lot of times people will say, I don't understand what care coordination is. That's one of the things. The other thing is, of course, medication review. And there are so many doctor visits at times that we tend to have our nurse try to help navigate that for the patient and their caregiver, so everybody can be on the same page and boost that quality of life so that people just feel more confident and not overwhelmed about all of the different things they have to do because they're dealing with such a serious illness. The other part that's very important is making sure that all of your insurance and other things are in order. There could be other resources within the community that are provided for free that maybe the patient and the family have no idea about. And so we will go ahead and have our social worker make that connection for the patient and the family, as well as do their advanced healthcare directive forms if they haven't done that, or maybe they qualify for Medicaid and had no idea. We would go ahead and help them with all of that as well. And if somebody needs spiritual care, we would provide one of our chaplains to come in and provide that care as well. So all of this is being done at home. And people will say, well, how do I pay for it? Well, for the most part, Medicare pays for a portion of it. And many people have Medicaid as well. And if that is the case, there actually is no copay. If Medicare is the only insurance that a patient has, then there could be a copay, and that would range anywhere from $20 to $40, whatever our nurse practitioner would visit or our licensed social worker. And so that would be the only time that there would be a charge. So in addition to those two that come to visit, we have, of course, our registered nurse. We have our trained volunteers as well that come to visit, and if needed, our spiritual counselor. And all of that is included in the palliative care program. Okay, so now we're going to move right on to our next program, which is what is hospice care. So hospice care treats the person versus the disease. So, you know, we're not looking at the quantity of life anymore. We're looking at the quality of life. How can we keep this person comfortable? And what people don't know about hospice care is basically that it was created to ease terminal suffering. Death is not a requirement, which we'll learn more about that as we continue on in our presentation. But a lot of people have these misnomers about, I don't want to call hospice because I don't want to give up on my loved one's care, or I've lost hope and, you know, we should only call hospice in the last few days. We'll talk a little bit about that more as we go. Hospice comes in to not only provide the comfort for a patient, but also to help the family as well. And so the earlier we can get in there to help the family, the better. Because when there's a loss or impending loss coming, people in the family need to build their resilience to the idea of that loss. And we cannot come in and help in 3 days and expect that to make a difference. But if we're with a patient and a family for several months, it is miracles what we can do when we do that. So we can provide the emotional and spiritual comfort and guidance and support that any family and patient would need. And that's largely because we focus on comfort. So before I go on to this one, Tish, do we have any questions, say, for Gail at this point yet?
Yes, Lani, we do have questions that came in for Gail.
Okay.
So Gail, one of the questions are, can you explain what is Anuenue Restorative Care Center? Is it what people call a long-term care facility?
Yeah, Anuenue actually has been serving the Hale community for now 24 years. So, and have been loving and caring and nurturing for the seniors of the area for a long time. We do provide long-term care services, which means people move into us and make us their permanent residents. But we also provide short-term care rehabilitation too. So individuals who have had some sort of trauma of any kind or illness at home or wherever they're living, generally speaking, go to the hospital and go through a short-term hospitalization. They get them well enough that they could come and participate in rehabilitation services here. So we do offer full occupational therapy, speech therapy, and physical therapy, one of the most important things that we do. Our responsibility is on a shorter term level to our short-term rehab people to come in here, get them prepared to go to whatever the environment they came from, ideally. And so they're here with us for a matter of weeks. With the government changes in the last few years of managed care, sometimes it's a matter of days that they're with us. But we have specific goals that we develop for them when they come. Our founding residents, however, are long-term care residents. We have folks who have been here for years and years and years and years and who have made Hale their home. Our responsibilities continue to be trying to support and help them be the best they can be, but at the same time provide them with a nurturing, supportive, and caring environment. And I'm going to tell you, we do that through our amazing staff that we have. We have a variety of departments. Yes, Lani, smile. Thank you. You've met a lot of our people. We've got incredible nurses who are so smart. I'm impressed with them every single day. Our CNAs are loving and caring people. Often our staff are the extent of the family members who can't be here. And I'm going to tell you, and I will probably end up talking about coronavirus sooner or later, but at least for now, we have actually physically become their families and carrying on the aloha for their families while they're here. Let's see, I'm talking, yes. supportive, nurturing, guidance, empowering is really important in our world too. So, you know, you don't think necessarily of those things. We think about our grandparents and the nursing homes that they were in of yesteryear. That is not what Anuenue is about. Again, we're a very alive place to be, no matter what you're here for, and happy to serve. Every single one of us here is here for a reason. It's a calling for most of us.
Wonderful. Thank you so much, Gail. Lani, I do have one more question, if I could ask that of Gail.
Yeah, go ahead.
Okay.
Sure.
So Gail, a second question. My attendee asked, my mom broke her hip last year, and we are thinking, since she may get better care in your facility, can you please explain how a person qualifies to be admitted? How much does it cost? My mom has Medicare and HMSA Akamai plan.
So I'm going to tell you, anybody who has HMSA, Akamai, and Medicare is wow. You don't see people often with those two plans specifically. Generally speaking, HMSA Akamai is a Medicare replacement program. But I do know people, my brother-in-law being one of them, who does carry both. So that's a pretty impressive and huge benefit. By the way, he's a retired federal government employee. So that's how we usually see those options. For an individual who broke their hip last year, the two differences between those two programs, if they were a Medicare participant when they broke their hip, they would have been eligible with a 3 midnight stay to come into Anuenue for rehabilitative services. So we would have gotten them buffed up and ready to return to their home environment. And again, that's with a 3-day hospital stay with Medicare. Interestingly enough, with HMSA Akamai, it doesn't have to be a 3 midnight stay, and it doesn't even have to be this year. So if services are needed, I believe there's 9 separate programs for HMSA Akamai that they can take benefit of. So they would be coming in for, again, short-term rehab, likely to utilize those benefits. Each of those benefits does have a copay, which I can't even begin to tell you what the 9 copays are. No idea. But we have a really amazing admissions team here at Anuenue, with actually our business office manager, who is one of the best reimbursement people I know, Miley, is in that office now. So she would be delighted to speak with anybody and let them know what the financial commitments are here.
Wonderful. Thank you so much, Gail, for answering those questions. Back to you, Lani.
Thank you so much, Gail. That's awesome. So let's go back to what is hospice care. So hospice care is provided by a care team for terminally ill patients. And so on your screen, you see how many people are part of this team. No, we don't come to your house all at the same time, but at some point we do visit you and your family and caregivers. So I'm just letting you know you are in definitely good hands. And so hospice care supports not only the patient, but the family. And hospice care is actually under the very large umbrella called palliative care. So it's a subset of palliative care. And this is very specialized because the philosophy of hospice care changes it, where it's all about the quality of life, not the quantity of life. So who qualifies for hospice care? A person who is suffering from a terminal illness. So the primary care physician makes his or her best guesstimate of 6 months to live, and patient is no longer seeking any type of chemotherapy, radiation, dialysis, etc. No more treatments, no more surgeries. Now, when I say doctor makes best guesstimate, people will tell me, well, what if mom lives longer than 6 months? That's wonderful. I mean, that's exactly what hospice was made of, meaning there are a lot of people that actually get admitted to hospice and then graduate from hospice services. They may come on later again, but for the most part, you know, they have this very intensive care at home, and then some people actually get better and no longer need those services. So that's who qualifies for hospice care.
All right, there is our poll party bell. You will see that the question up on the screen is, hospice is where you go in your last days, true or false? Again, just want to reiterate, anyone watching on Facebook Live, unfortunately, you will not be able to engage in the polling. But if you want to join the Fully Engaged Zoom next month, email me at lfukushima@hawaiicarechoices.org. Okay, we got some questions coming in there. There's a lot of different answers. Again, no right or wrong answer. Okay, excuse me, we're going to go ahead and end that polling, and I'm going to share the results. So hospice is where you go in your last days. 33% of you said true, and 67% of you said false. Thank you so much for participating in our polls again. Lani, back to you.
Thank you so much, Tish. So good. I'm glad that we took that poll because it's very important for everyone to understand that hospice needs to be called as soon as you possibly can. And the reason is because it's difficult for us to provide true quality of life for your loved one or yourself if we only have a few days. And largely, that is a myth that many people were under the belief of, is you call hospice in your last days. But now, because you are one of the wonderful people that have come onto this presentation, I'm able to let you know that call us as early as you possibly can, because that's how we can actually make a positive impact on the care that we provide to you or your loved one. So again, when people think, well, how do I know if my loved one qualifies or is ready for hospice care? Here on the slide, you see the list. It's similar to palliative care, but then you start to see a lot more physical changes in the body. And so, losing weight, also not, the balance is very off. There's a lot more falls at home, decrease in appetite. They don't want to drink anything, difficulty getting out of a chair or bed, or maybe just sleeping most of the time and staying in bed. And also the skin quality, the skin starts to really thin out, and then there's all kinds of infections and wound care that is needed. So how does hospice care work? We actually come to the home. 99% of the care that we provide is provided at home. We also have an inpatient care center, which I'll touch on briefly. But that's what we do, is we go home wherever a patient calls home, and we provide the care there. Why? We feel that people heal much better when they're in surroundings that they're familiar with, and also with the support of their loving family with them. And so that is where hospice care is provided. We also provide all the medications associated with whatever the diagnosis was that got someone admitted to hospice care. And also there's access to our guidance 24/7. So it doesn't matter at 2 a.m. in the morning, you need to call us. We'll actually call you back and let you know, when mom is not breathing or something, this is what you do. And also people can keep their primary care physician if they wish. That is something that many did not know. Do we have any more questions for Gail, Tish?
Yes, Lani, I do have questions for Gail. Gail, what kind of precautionary changes occurred because of COVID-19 at Hale Anuenue?
Oh my goodness. So I even know the date. It was March 7th nationally, when all nursing homes were shut down to people who were only allowed to screen in. So it's been 6 months, over 6 months now, that we've been living this journey. So about 4 days later, we got a guidance from the CDC and CMS, who said, okay, now it's time to stop having visitation. So it's been that long since our families, loved ones have been able to come see them at Hale Anuenue. The only folks who come in are folks who are considered essential healthcare workers. And then we have had to have obviously some service people coming in. So the air conditioner guy had to come in at one point. We want people to be comfortable. Of course, we're going to be doing that. But again, part of our considered essential healthcare workers our good friends and partners from Hawaii Care Choices. So they do have access to our residents at Hale Anuenue, and we're so appreciative of that. We have gone through many iterations, and regulations for us change literally daily sometimes, but we do our best to keep up. The blessing for Hale Anuenue is that we are managed by Life Care Centers of America, who has become really good at managing coronavirus, but also provides us with an interpretation and supports and written policies for the guidance that's put out, which is good. But we're doing everything and have been doing mask wearing, which is in the news all the time. And it talks about the prevention of the disease, and we really truly believe that it does. We have been screening our staff in and out, so we're aware of what they've been doing, where they've been traveling, if they've had any exposures at all. That comes out during the screening process. They screen in the morning, and we take their temperatures then, but also at the end of the shift, we have them screen out as well. Training, training, training. That's been the name of our game, which is good. And again, we find where it has made us very nimble in being responsive to whatever the needs of the residents are. Something big that we did was we took the initiative to set up our own unit, and we did that in April, anticipating and in the event that we would have a need for a unit that could take care of COVID management, individuals living with COVID management or COVID needs, that we would be able to put them in an isolated area in the building and observe all the PPE precautions. You know, it's funny, PPE now cracks me up. Everybody knows what PPE is. 6 months ago, nobody knew what PPE was unless you worked in the industry, right? Or one that prevented. So even Mr. Roth knows what PPE is, right? Yes, he does. So yeah. Anyway, yeah, so all of those processes have been in place. Recently, we started doing testing. The CDC has now said that all nursing homes across the country have to test their residents at least once. We recently had one employee who I'm so thankful, again, the training has paid off. Her mother-in-law had to go in for some pre-surgical testing and ended up with a positive test. So very wisely, she called her manager right away and said, you know, what am I gonna do? My mother-in-law had a positive test and we have dinner with her. So he said, listen, you stay home. So we took her off for 14 days just to see what happened. She decided very wisely to go get her own test on Saturday. We weren't gonna require her to do that, but she wanted to know what her position was. So she went in, she found out she had a positive test. And again, thankfully, and very wisely called us so we could do what we needed to do. So that launched into full house testing last week for all of our residents and staff. Everyone who's been tested has come up with a negative, except for one contractor who's with us, ended up with a positive test. What's mysterious about that one, and I'm going to share this additional information, which has nothing to do with our preparations, but it's kind of interesting to know. He had coronavirus 6 months ago, coming in from was fine when he got here, quarantined for 14 days, didn't leave the hotel room. We were dropping off Starbucks for him at the desk with some regularity. Poor guy needed his Starbucks fix. And so he came to us very healthy. But for whatever reason, and nobody's really clear why, he turned out to be the one positive test we had last week. So again, quarantined him immediately. His exposure has been limited, so we isolated those residents that he'd been working with, and we're doing fine. So again, there's many bits of education for us along the way, and those are just some examples of the thinking that we have to do and the nimbleness we have to have every single day.
Mm-hmm. Mm-hmm. Wonderful. Thank you so much for answering that in length. I do have another question. Does hospice provide care to patients at Hale Anuenue even in these COVID times?
Yes, they do. In fact, just recently we had one of our residents who had been with us long-term moved in to Pohai. So we're very blessed to have hospice as active partners of ours. Interestingly enough, we refer to each other. Lani was talking about some of the graduates from the hospice program at Hawaii Care Choices, and we've been able to share referrals with one another. So we love this partnership. I'm so pleased. I've only been in Hawaii this time for 16 months, and I was so thrilled to be able to rekindle our relationship with Hawaii Care Choices after coming. So again, valued partners, and we're blessed to have them.
Wonderful. Thank you, Gail. Lani, I have a question for you. On hospice care, is there anyone who stands up for the patient's pain meds? He's being pressured to take minimal pain meds because without more pain meds, he cannot do Tai Chi and more chances of falling. Let's see. Yeah. Can you answer that for me?
Yes. Well, if the person is on hospice, and in fact, thank you so much for that question. If the person is on hospice, it would be difficult for me to just know in general what the situation is. But for the most part, when it comes to hospice, I don't want to say that we're extremely liberal on how we provide our pain medication, but comfort is king in our world. So I don't exactly know what the situation would be on the back end with regard to that, but we want to make sure that we are providing people the comfort that they would like. And also, people will say, hey, I'm experiencing a lot of pain, but I want to be up to talk to my grandchildren. And there are ways that we will measure the quantity of our medication to ensure that people are still alert, etc. So if that person is on hospice, I would definitely double check with the nurse, because it is one of our main goals to maintain comfort for any of our patients, particularly on hospice. And that's the other thing too, is in working with Gail, what's great is that hospice has access to a certain level of medication, largely because we're there to provide pain-free comfort. And sometimes not everybody has access to that. So when you put the two together, the collaboration is very, very powerful. And so we're very grateful to have Gail on the other side too, providing that 24-hour service as well.
Thank you so much, Lani, for answering that. At this moment, there are no more questions.
Okay, let's continue on. Next slide, please. Okay, what to expect when you sign up for hospice care? Well, besides paperwork that you have to sign, a plan of care is created. A plan of care is created based on the patient and family's goals. So, it's important when we come into the home to find out what is important to the patient, because we want to create the number of visits that we make and all of the different care in alignment to what the patient would like. So these choices are provided all the way to a patient's last breath. And that is really important for me to emphasize here so everybody understands. The plan is about the patient, and that's what patient-centered means. And that's how we determine who comes, when they come. And I'm talking about our entire team on when the social worker comes, when the nurse comes, etc.
All right, there is that brain teaser again. So it is up on your screens. The question is, my culture expects me to take care of my family with healthcare needs at home. Again, just to reiterate, anyone on Facebook Live, unfortunately, you are not able to engage in these polls, but please email me if you would like to join in on our Zoom presentation next month. That's lfukushima@hawaiicarechoices.org. Thank you for all of those who are just voting in with your answers. We really appreciate you participating in these polls. Okay, that is the end of our polling, and I will share the results with you. So 27% strongly agree, 64% agree, 9% disagree. Thank you so much again for participating in our polls. Back to you, Lani.
Thank you so much, Tish. So this is our inpatient facility, Pohai Malama. And people, unlike Hale Anuenue, people do not come here for long-term care. So probably the average time that people come here is maybe 14 days. And the reason that they come to this patient care center is because they're having symptoms that cannot be controlled in whatever environment they're living in. So they come to Po'ai Malama, and we will manage and normally stabilize their symptoms. Now, I'd say probably 95% of the people that come here will pass here. And so it is such a beautiful place. It's the Mauna Lani of hospice for sure. And what happens though is people will say, oh, you know, I want to make reservations to stay there. Well, there's quite a big trade-off to come to Po'ai Malama. And so I'm just saying that people come here for a very specific reason. And when they do, we try to keep them as comfortable as possible. And if we're able to manage their symptoms and send them home, that's by far the first option that we go for. But if not, it's such a very, very peaceful and beautiful place for anyone to pass. Now, if somebody has Medicare, then there's probably going to be a fee for room and board. And if somebody has Medicare and Medicaid will then cover the room and board. So people will say to me, oh, I had no idea, you know, I would have signed up my dad for a Medicaid long time ago. And that's why when our social worker comes in and somebody comes in as early as possible, we're able to help the family prepare in many different levels. And so that would definitely be one of them. So how is hospice care paid for? Like I said, on Medicare, if you're having hospice at home, it is covered 100%. Now, my personal experience with hospice is that when my mom and dad, well, in fact, when my dad had CHF and he had a hard time breathing, his only wish to us was that he wanted to pass it home. And so we thought, piece of cake, Dad, we can handle. Anyway, one evening he can't breathe, and so we call 911. They whisk him off to the hospital. And by the time we get to the hospital, he passes. So that was just an epic fail on our part, and we were really devastated by that. Years later, my mom is diagnosed with lung cancer. And she is at home, and her doctor says to us, you know, your mom is able to get hospice care at home now. And, you know, at that point, we had no idea, like, what is hospice care? What do you mean? What are you talking about? Anyway, he goes ahead and explains it to us. And so my mom, just very stoic, pure Hawaiian woman. I mean, I knew she wasn't going to go for it. So I had to approach it slightly different. So when I went to her, and we're part of a very large family. I have 8 siblings and I'm the youngest. So my brothers just put me up to it. So I go to her and I say, Mom, so the doctor said that you can have hospice care now at home. And then, oh, her face, you know, it just changes like, oh, I can't believe that you're even saying that to me. I don't even like that word. I don't need hospice. I'm going to live a long time. I don't need that. So I said, oh, okay, so you're not about hospice. She goes, no, I don't need hospice. And I said, oh, okay. And obviously it's because she has some predetermined ideas and beliefs about hospice, of which there was no time for me to unpack that at that point. So I just continue. So I said, okay, so I'm actually having the conversation with my mom, unbeknownst to me at that time, but that's what I'm doing. So I say, oh, Mom, so, all right, you're not about hospice. No, I don't need it. I said, oh, okay, well, you know, because brother is already paying for, you know, your wheelchair and who knows what other things. I heard that hospice gives us free stuff. What? Free stuff? Oh my God, like what? And I said, well, I heard that, you know, we can get the hospital bed, oxygen and whatever. You know, I know that you don't need all that stuff right now, Mom, but I mean, gosh, we don't have to pay for it. She goes, oh yeah, to save money. Yeah, maybe. Okay, I said, all right, so Mom, why don't I go and check it out? And she goes, yeah, why don't you do that? Because I bet you there's some kind of gimmick. Because who's paying for this? I said, oh, Medicare is paying for it. Oh, the government. Oh, no, yeah, you better go check because guarantee, you know, we're going to get some kind of invoice and I'm not about to pay for it. I said, okay. So I said, but Mom, if I find out that we can get all of that, do you want to go for it? She goes, oh, okay. Yeah, okay, let's try it. So I go ahead. That afternoon, all of the stuff comes in. I'm talking oxygen, the bed that goes up and down, you know, the little side toilet chair, everything was, it just got delivered. So she was flabbergasted. She says, oh my gosh, all of this, who's paying for it? I said, I told you, Medicare covers it. She goes, oh no, but what's the copay? I said, hospice at home is covered 100%. So as months went on, and her social worker came, and her spiritual counselor would come, and they would pray together. And my mom was Mormon, so you know, she was more about talking story than actually doing all the praying thing. But what happened is, then she said to me, you know, this hospice is so wonderful. I'm so sad we didn't get it for Daddy. And I said, yeah, Mom, I'm sad too. We didn't know. Our doctor didn't tell us. And so now she tells me, well, you go out and you go tell all the neighbors, because of course we're living in Hawaiian homes. So she's like, go out, tell all the neighbors, because I know they're not going to know about this. And they're going to go straight to their grave and not know that they would have had all this benefit for free. And I said, yeah, I think it's a little awkward, Mom, for me to go over there and go talk to them now. So, you know, I'll think about it. And she goes, you know what? You got to promise me that you go out and you tell everybody about this hospice thing, because I would not know. And look, Daddy didn't even get that. I said, I know, Mom. And now look, 10 years later, here I am just sharing it with all of you. So this is not a job that I have. This is a promise that I made to my mother. And so all the things that I'm sharing with you today is from my heart to yours, because I don't want any family to be in the same situation that I found my family was in when my father passed. So in any case, this is why I tell you, hospice care at home is 100% covered under Medicare. And all the other insurances, should you have Kaiser, HMSA, Veterans Administration, Medicaid also covers it. It's all covered. So just know that if you go to a private care facility, it's important to have a secondary insurance such as Medicaid so you can cover the room and board as well. Next slide, please. So who trains all these wonderful volunteers? We definitely bring them in. We train them, and they are just angels on earth for us. As they come to the individual homes and they see the patient, and they're able to stay with the patient while the caregiver goes and runs and does errands, you know, mow the lawn, whatever needs to happen, or just go to sleep. Our volunteer will come and stay with your loved one for a few hours each week and really build that bond. In fact, a lot of times, even though our patients graduate, they still want to see their volunteer. And that is the reason many of them will come back again. Besides needing our services, they really look forward to their volunteer. So Tish, I hand it to you and find out if there's any more questions.
Yes, Lani, there are a lot of questions for Gail, but I do have one for you. In regard to Pohai Malama, my husband is covered 100% by the VA. Would he go elsewhere?
For those in the Veterans Administration, they too come to Pohai Malama as well. And in fact, we have a special program for our veterans as well, because we have a program called We Honor Our Veterans, and we put even a little flag on the outside of their door, so everybody that comes to the facility knows that there's a veteran in that room.
Thank you so much, Lani, for answering that. Gail, I have a question for you. The question is, what is the difference between your family, or excuse me, your facility and staying at a residential home?
Sorry, so when we say residential home, we're talking about their family home. Is that correct?
Yes.
Okay. You know, there's no place like home, right? And there's no place like being family, so we get that. The folks who come to us are people whose needs can't be met at home. So it could be anything from frequent falling, medication management. We see a lot of diabetics, particularly in the state of Hawaii. It could be problems. Lani talked about activities of daily living earlier associated with bathing and dressing and dining. They may need assistance with that. The difference between us and at home, though, is we have 24-hour awake supervision, monitoring and interactions with licensed nurses. We always have an RN in the building 24/7, 365 days a year. And generally speaking, we have several of them, as well as LPNs. We also, the primary caregivers are certified nursing assistants. But in addition to that, we obviously need more people than just the nursing staff to take care of the residents. So we've got environmental services people to make sure our building is maintained and kept clean. And I'll tell you, we've been looking into the sanitation and disinfecting products like maniacs lately because of the cards we've been dealt here with the pandemic. We also have social workers who also look at their any kind of support needs that they have. Be they financial, be they emotional, just a wide range of topics. We have a team of activity providers who also support life enrichment activities for our residents. It's important to keep people stimulated and engaged. And so those folks play a hugely important role for us. We have laundry services too. So we have a broad team. We have a registered dietitian too. He makes sure, his entire job is to make sure our residents' nutritional needs are being taken care of, as well as being well hydrated all the time, which is another huge problem that we see often. We have a culinary team too, and their job is to make sure we're serving diets to our residents that they enjoy, that have the same local flavors that they would enjoy at home. And if we know about anybody's favorites, we try to get them to them as much as possible. So for us, it takes a lot of us. And then of course, they need somebody like me and our director of nursing to be kind of leading the charge and supporting as in any capacity we can. So everybody is truly hands-on here with all of our residents every day.
That is wonderful, and I'm so thankful for all of those people working there, even during COVID. Another question is, what physical signs of decline should we look for, and what considerations should we take regarding our aging loved ones to see if he or she might be needing to go to a facility like Hale Anuenue?
You know what's interesting, as Lani was going through some of the prerequisite requirements and a few of the things they look at, as far as doing a pre-move-in assessment, a lot of them are the same as what we're looking at. I talked about the activities of daily living. Are people frequent fallers? Do they have a medical condition? Often with diabetics, we see people who have skin management problems with diabetic ulcers, or just have general wound problems, or have had a surgery with a wound that didn't heal. So anybody who has a decline, and those may be part of it. But we also see too, more simply than that, some of our residents who come with us and stay long-term care, their bodies may be giving out on them, but their minds may be fine. So we certainly embrace those folks. And then we have the opposite problem too. The mind is being challenged. Did I say that yet? I may be going backwards. Anyway, bodies are challenged, minds are okay, or my mind is being challenged right too. But if there's a physical need or a mental need for support. So we have just a wide range of people who need our services here. Some people have debilitating diseases that just can't be managed at home anymore. So we find that they come. But we have a clinical review first before they come in, just to make sure that we can meet their needs here. And then we meet with the family and review the entire process.
Okay, thank you so much, Gail.
Thank you, Gail. That is just so great. So I just wanted to move along with letting everyone know again that we do provide bereavement care for those who are in our hospice program, and for those in the community who may need support due to an unexpected death that may occur due to a car accident or something. We do provide free bereavement support that happens every Tuesday at 10:30, and all of the support groups are met online over Zoom as well. So you could certainly email Tish, and she could give you information on that if you'd like more information regarding that. We'll also be starting our children's bereavement support groups coming up next month, and we'll be doing a virtual teen camp as well. So during this time of COVID, we're getting extremely innovative in how we use Zoom. So rest assured that no matter what we present, we'll do it safely at all times. And this is just to let you folks know where we operate. So our service area is from Lapahoe Point all the way to South Point, Ka'u. So a lot of times people will say, oh, don't you go farther than that to Ocean View? And we don't. The Kona Hospice covers Ocean View. And so the way that the island is covered, all the areas that are colored are the areas that we cover, Hawaii Care Choices. All the other areas are covered by Kona Hospice as well as North Hawaii Hospice. So all of the entire island is covered by hospice. It's just different organizations of hospice, and we all work together quite well. And okay, so now let's have our first question from Mitch.
Hi, Mitch. How are you doing?
I'm doing fantastic. How are you guys doing today?
We are doing well. Thank you again for joining us. So yes, we have questions for you. Can you explain why you are a hospice advocate for hospice care? And if you had a family or friend in hospice, how was that experience?
So yeah, you know, it's interesting. The prosecutor's office, we had a kapuna program for many years, and so I would go out with and talk to different kapunas about theft and crime. And so I thought I knew everything about, you know, this kind of thing. In November of 2018, my mom ended up in the hospital in California, and I went up there and I started visiting her. It was just around Thanksgiving, and they basically told us that she had a couple of weeks to live. And it was kind of a shocking moment. And so I ended up spending about a month in California, and she, you know, ended up going to a care home and then back to her own home. And I, you know, had to work, and so I came back home. In June of 2019, I got a call. I was on the golf course, and we were in a tournament, and my brother and sister were on the phone, and they were crying, and they say, you got to get up here. And so that night I was on a plane, and I was in California with her, and we were in the hospital. And, you know, the next day the doctor sat us down and told us that, you know, she's maybe has a day or two to live. And we started looking at what options that we have. And, you know, it was tough. And, you know, we moved her from a joint room to a room that she could stay in by herself to last the last week of her life. We asked about taking her home, and they said, well, she probably won't even make the ambulance ride home. And so after a week, they said, well, you know, she's doing well enough that we can send you home and have hospice care. And so, you know, in November, I wish we knew that we could have done that, of 2018, because she could have had hospice care at that time, but we just, you know, we didn't understand what hospice was. And so a lot of this conversation that you had today is just like bringing back memories of things that, you know, we thought we knew a lot, we knew nothing. We thought, you know, all the misconceptions, we thought it's going to be, you know, really expensive. I'm thinking about Pohai Malama, how nice that is over there. And geez, that must cost a bunch of money. I heard like that, you know, it's like $15,000 a month to be in one of these places. And how are we going to afford these kinds of things? And so she went home from the hospital. We chose a hospice. In California, there's a whole bunch of choices. And so we had a hospice person that was actually in our house with her for the first week. Night and day, they had people that were there. And they told us after a week that, you know, she's, you know, probably got a couple of weeks to live, and it doesn't look like it's going to happen right away. So we got some home health care people, and hospice would come 2 to 3 times a week. And so this is June of 2019 that, you know, we're going through this, and I'm in California. And I'll just give you a spoiler alert. I talked to my mom this morning. She's still at home. She still has hospice care over a year later, and they're still providing services. They come several times a week. And I knew I was giving this talk, and I said, Mom, what is it that you really like about hospice? And so, there's so many different things that hospice does, but I'll share with you my mom's favorite thing about hospice is that she has her spiritual counselor that comes, every week or every other week, and he sings with her and he brings up her spirits and sits with her, and it's like, so I mean, it's pretty amazing. I mean, as Lani was talking about her mother, is just thinking about when my mom went home. The first thoughts are, where are we going to put her? And the hospice counselor met with us, and they said, oh, before you even get home, we'll have the hospital bed there. We'll have everything that you need, the oxygen. She required a BiPAP or a CPAP machine. I think it was a BiPAP that to keep her breathing. And one of the things that the doctor didn't even know is, I don't think they can do a BiPAP. Well, they have a BiPAP machine, and so she has a breathing treatment. And remember that she was given 2 days to live. So she's outlasted her expiration date a couple of times. I mean, she's still going. By the time we got home, they had everything there, and it was ready for her to be put into this bed. Now, interestingly enough, she wasn't very comfortable with the first bed that she got her, and so we asked, and they got her another bed. And I think we went through about 2 or 3 different kinds of beds until she was actually in a bed now that she's really comfortable with. There was things like medications. Well, they can't have medications. Well, actually, hospice takes care of her medications. When we were in the hospital, she was on IVs, and so when they told us they're taking out the IVs, and it probably won't last long without the IVs. Again, she's been pretty strong. So she has medications to take care of her pain. I was listening to the question about pain management, and we went through this whole thing where she was on morphine, and she would sleep for a whole day, and she didn't like sleeping for the whole day. And so we talked to the hospice doctors, and they changed her medication. They changed the amount to an amount that she's satisfied. So definitely those things they can do. There's so many things I can say. It really is, though, about quality of life. For us, we thought that we had to put her in a home, but she has her mental faculties, and we couldn't do that. So right now we have healthcare providers at her house, which is actually cheaper than putting her into a lot of the care facilities. And we have our hospice workers, the hospice team. Somebody's there, several times a week, and whether it's the nurses, whether it's the people that are bathing her, whether it's the people that are spiritual advisors. For the first couple of weeks, I think the other thing that was really important to us is, how do we get through this? And so, they had a team that talked to us, and we went through the whole thing about setting up a funeral and everything like that. And that was over a year ago. So we're
Wow.
It's really interesting. What kind of going back, and I don't want to repeat myself too many times, but in November of 2018, we knew what we knew then, because she was given 3 weeks to live at that time. We would have saved a lot of money. We would have saved a lot of heartache. And so what Lani's saying about, the sooner the better to contact, that's really true. And I can really attest to that, because once hospice came on board, it not only took care of my mom, but it really helped my brothers and my sister and family. and I mean, it was truly amazing. And so I can't speak highly enough about what hospice provides. And for my mom, the other thing that was interesting is that because she's on Medicaid and she gets like $1,600 a month for her, she didn't qualify for a lot of things, but she did qualify for hospice, and hospice is amazing. So I'll end it at that, because there's so many things I want to say, but everything that Lani talked about, we've went through all of it.
Thank you so much for just being so open and sharing your experiences with all of us. There are so many questions that are coming in for you, but unfortunately we don't have too much time. So I'm just going to ask two more questions for you, Mitch. And the second one is, what is the prosecutor's office responsible for?
Excuse me, what was the prosecutor's response to?
What is the prosecutor's office responsible for?
So, generally a prosecutor's office is responsible for trying cases, and that's the traditional mission of the prosecutors. The police make the arrest, the prosecutors try the cases. Our prosecutor's office on this island has taken a larger stance of what we're responsible for. And so for me, it's really about making sure that we have a safe community to live in. And so one of the reasons that we got involved with this is because we were looking at crimes against seniors. And, as we got into the crimes against seniors, we started seeing all these other issues that were out there. And we're, trying to make this a healthier and safer place to live. And you have to look into these other things. And knowing that you have hospice services out there is really beneficial to the health and safety of our community.
Thank you so much. For our last question, if you are elected mayor, how would you handle the COVID-19 to stop the community spread and get people safely back to school and work?
Well, it's a really interesting question. Right now, the governor is making those choices, but I think that there's a lot that we can be doing to work together, to communicate what needs to be done, to make sure that people, are distancing themselves, wearing masks. But it's probably, different things than we're doing right now. Maybe just a little bit better communication. The communication has been getting better. And also working a little bit closer with all the other mayors and the governor, so we're having a unified voice rather than different voices out there.
Thank you so much. I want to just let everyone know, thank you so much for submitting your questions. Unfortunately, we did let everyone know that we are going to end our presentation at 11:30. We do want to respect everyone's time, and Mitch, your time, Gail, your time as well. But I just want to go ahead and say thank you for sharing all of your thoughts and your experiences with us. Lani, is there any other things that you want to say as well?
You did.
Oh.
I just wanted to ask Mitch one last thing. Mitch, we're finding with all the kupuna who no longer want to come to their doctor's offices and would prefer to have telehealth. Is there any projection in the pipeline possibly to impact bringing broadband Wi-Fi to the rural areas of our island so that people can get access to these virtual services?
Yeah, so I'll take my prosecutor hat off for a second and just tell you, with every adversity, there's always an equal or greater opportunity. And so there are lots of different opportunities. I think, one of the things that we're looking at is building our technological infrastructure, not only for telehealth, but for, telecommuting for work and, education, teleeducation. I think this has really opened up some opportunities, and there are some really great opportunities out there that we're looking, whether we're talking about fiber optics, fiber that's coming over from the mainland going through Asia. We have an opportunity there. And also things like the HASP, which is a fixed wing aircraft that can stay up for 3 months and, provide broadband services to the whole island at one time. So we're looking at a whole bunch of different things and possibilities.
Very good. Thank you so much, Mitch. I really appreciate that. Not getting ahead of ourselves, but, it would really be helpful if more of the island had broadband. So I really appreciate that. And I think we're moving on to our final thoughts now. Okay.
Right. Yes. So that's the bell. There is no poll that will come up next time, but I just want to say thank you everyone for attending today's Healthcare Talk story. A very special mahalo to our special guest speakers, Gail and Mitch, for your valued time. Thank you. Thank you so much. And your helpful perspective shared today in our talk story. At the close of this presentation, for those joining us on Zoom, there will be a quick 8-question survey that will pop up on your screen. We would love to get your feedback on your presentation today. Your input will allow us to gain better understanding of how we can best serve our community with presentations like these in the future. If you feel that you have benefited from this presentation, please let your friends and family know that they are welcome to join us every month, the 10th at 10 a.m. So again, the 10th of every month at 10 a.m. Just RSVP to myself for the Zoom link. It will be right up here on the screen. So please email me, lfukushima@hawaiicarechoices.org. Mahalo to all of those of you who tuned in on Facebook Live. If you'd like to get on to our Zoom webinar next month so that you can engage in our polling, please, again, email me. We can send you the link for that. At this time, we do have about, 10 to 15 minutes left. If anyone of the attendees would like to chat into the box, just giving your last takeaway, one takeaway from this, and I can go ahead and share that, any comments that you have. And Gail, I'll open up the microphone to you. Gail, is there anything, any last words that you would like to say?
I just really appreciate being in this great panel today. Thank you so much. Always great to hear about the processes at Hawaii Care Choices. Mr. Roth, we wish you the best for your big adventure coming up here. And Tish, thank you for everything. If anybody has any questions, though, particularly about the admissions processes, please call us. You can either speak to me or the person who really knows what she's talking about, and her name is Miley. And our telephone number here is 961. My commercial, Lani, sorry.
Yeah, awesome, girl, go.
961-6646. And of course, we're online too. So please call with any kind of questions, concerns, anything we can do to support. Thank you.
Thank you so much. I'll hand it over to Mitch. Any last remarks for you?
I just want to thank you for the opportunity, and thank you, Lani and Gail and you guys. What you do is really amazing, and I like to think of it. You guys do God's work, and just thank you for doing what you do. It's amazing, and thanks for the opportunity to be here.
Thank you, Mitch. Thank you so much for taking some time out of your busy day and joining us. I just wanted everybody to see how friendly you are.
Thanks, Lani.
Thank you so much. Thank you. Back to you, Tish.
Thank you so much again. Going ahead and getting the comments from everyone. Just again, a great mahalo to Lani for presenting such an easy presentation to understand and sharing your story. Mahalo, Mitch, for sharing your story about your mom as well. Another comment is, Gail, thank you so much for giving us so much information about Hale Anuenue. Thank you everyone again on Facebook Live and all the attendees on Zoom webinar. Just to reiterate again, for those of you on Zoom, if you could please stay on for an 8-question survey, we would really appreciate it. Thank you everyone for joining us. Mahalo and aloha.
Aloha. Aloha, everyone.
Aloha.